Karen, let's do this. A possible side effect some COVID-19 survivors are experiencing is hair loss. And a recent survey from Indiana University found that out of about 2,000 participants, about a quarter of them had hair loss. And so we took notice of this last week when actress Alyssa Milano recently shared her own experience after disclosing she had the virus. And she got it early. It was back in April.
I just wanted to show you the amount of hair that's coming out of my head as a result of COVID. This is a detangler brush, my favorite detangler brush. As you can see in there, there is no hair in there right now.
A lot of hair after she uses the comb. So Dr. Stephen Hess from Center City Dermatology is with us now. Dr. Hess, thank you. So I know the virus is new, a novel virus, but are you getting any idea why this is, why there's hair loss with some patients of COVID-19?
Well, Mike, that's a great question, and we think that the virus, the COVID-19 infection, can trigger a condition called telogen effluvium, and that is a sudden stress or illness, particularly an illness like COVID-19, which is associated with high fever in some patients. And what this does is this can trigger the body's hair follicles to go into the resting phase, and then that will result in a diffuse shedding of hair. And this can actually happen with a number of different illnesses, not just COVID-19, but we think that's the cause here.
Okay.
So, doctor, why do we see this so often with women?
Another great question. I do think that stress-related hair thinning does tend to be more common in women. It may also be the case that women are more bothered by hair loss and more likely to seek treatment than men. A lot of men may attribute their hair thinning to genetic causes or other reasons, but I do think it is more common in women.
Well, it seems like we always talk about stress when it comes to hair loss. I guess this could probably a factor.
100%. So the illness itself and the fever associated with it may trigger hair loss, but the stress as well, the psychological stress of getting sick with COVID. Also, patients are experiencing a lot of stress, financial stress from the pandemic, as well as maybe the stress of losing a loved one or taking care of a loved one with COVID. And I'm actually seeing a lot of patients in my practice who have significant anxiety over catching COVID, and I think that may be contributing to hair loss as well during this time.
So it takes so long for our hair to grow. Are there some tips for what we can do to either help restore it or some good practices?
Slow it down?
Sure. Well, one obvious thing is to try to reduce stress and manage stress if possible, whether that's through exercise, meditation, things like that. I think also maintaining a healthy lifestyle, including exercise, good sleep habits, and probably most importantly, a healthy diet that has adequate intake of protein and vitamins such as vitamin D as well as iron. So those are some strategies you can do to try to minimize hair shedding and hair thinning.
It's always the same thing. Get some sleep, eat the right food, exercise your body. Dr. Hess, thank you for joining us. And it seems to me like you probably know a lot about hair loss.
Yes. We treat a lot of hair loss at my practice, and there are other causes, of course, aside from stress and COVID-19. So if you are suffering from hair loss, the best advice I can give you is see a professional, see a dermatologist, and we can do a thorough workup and develop a treatment protocol to help to treat you. Thank you for your time.
Sure, thank you.